Hi, this is Dr. MJ coming to you from beautiful Boston, Massachusetts. This is the Women in Dentistry podcast, where we feature women in dentistry making waves and leading the industry through the next decade. I am your host, Dr. Mary Jane Hanlon, a former dental assistant, dental hygienist, and now dentist. I am very pleased to introduce you today to Ms. Rebecka Clark. She states there is room for greater awareness among dental professionals and patients regarding the importance of orofacial myofunctional therapy in pre-surgical and rehabilitative care. Rebecka Clark's programs highlight the benefits of utilizing an allied healthcare team to provide both recovery and preventive orofacial care services in the office and comfort of patients' home. Rebecka is a military veteran who served in the U.S. Navy during 9/11 and participated in Operation Iraqi Freedom and Operation Southern Watch. After her service, she joined the Florida Army National Guard and assisted in Hurricane Katrina efforts. She started her career in dentistry in 2009 and became a hygienist in 2015. During her studies, she developed a passion for treating orofacial disorders and pain due to her own experience with facial surgery. Rebecka holds dual licensure in dental hygiene and massage therapy. Additionally, she has received extensive education in other aligned therapies. She aims to educate healthcare providers on the benefits of a comprehensive approach to orofacial recovery by combining integrative therapy techniques for optimal results. It is now my pleasure to bring you to my interview with Ms. Rebecka Clark. Rebecka, I'm so excited to have you on the show today. Thank you so much for taking the time to join us and be with the audience today. I am really excited to hear your story. And without any further ado, can you give us an intro into how you got into dentistry, what you're doing today, and how you possibly got there?
So it actually goes back when I was 10, 11 years old. I always knew that I wanted to go into healthcare. I just didn't know what I wanted to do. I looked at nursing and surgery and being an EMT and being a firefighter, and there's so many options out there for people, and I just wanted to help people, but I didn't know in what capacity at that point in time. But I knew that it needed college. I knew that I needed education. And I come from a family. I have three sisters. My dad was in the Navy. My parents met in high school, and they divorced when I was 2 years old.
Sorry.
I think with the nuclear family is kind of evolved. So I moved around quite a bit with my dad, and lived with my mom and lived with my dad. I was kind of the flighty kid. I didn't know where I wanted to be or what I wanted to do or where I kind of fit in. And so moving forward, my dad being in the military and knowing that I wanted to go to college, he told all of us girls, if you go in the military, I'm going to buy you a car. And I was like, done. So I ended up graduating high school a year early. And I was always that motivated kid. I wanted to get out of the house and just do what I wanted to do. I was 17. And my mom signed me over to go to alternative school. I graduated a year early. And right after my 18th birthday, I was gone in the Navy. I didn't score high enough on my original ASVAB. And I ended up going in as a diesel mechanic, which was fine because I grew up with my dad working on hot rods and cars and things like that. That was just what I did. I'm very kinesthetic. I liked taking things apart. Even at 6, 7 years old, I was that kid that took things apart just to put them back together to see how it worked. And so when I went in the Navy in 2000, I served with it on the board of USS George Washington. And I went overseas twice. We served with post 9/11. I was on the carrier right after we were outside of the New York harbor on September 12th. So we were off the coast of North Carolina on September 11 when we heard everything that was going on. And we were the only fully manned carrier within the vicinity because we were doing workups. So 9/11, hightailed it up to the New York Harbor outside. And, I being an 18-year-old kid looking at everything that's going on, it's just surreal. You just don't realize, you join the military at that point in time, I knew what the military entailed, but I didn't. All I knew is that I won because my dad bought me a car, right? And so, but then it got real and I got surreal really fast. So after that, we went overseas. We did our first tour in 2001 and we went over to, we traveled Europe quite a bit. And that was Operation Enduring Freedom and then Operation Southern Watch. So we went twice. I went in 2001, 2002 for a 6-month span. And then I went back 2003 to 2004 for a 2-month span. 6-month span. And there's quite a bit that you learn going overseas with ship warfare. And when I was worked as a diesel mechanic for about 3 of those 4 years. And then after that, I went and worked with security because when you're in the Navy, you have to work in different departments. So you get an idea of the other jobs, and even though you have a designation. And so I worked with security and I worked in the brig, which is the jail, military jail. And, by the time I was 22, I had seen the world twice. I was a flight deck troubleshooter. I was the only one that would fit underneath the equipment to on the top of the flight deck to make sure that it still worked. Just high tempo, go fast, fast, fast. So I got out of the Navy in 2004 and I'm from Washington. I moved to Florida. At that time, I lived with my dad. I was decided that I was going to go to school for nursing. And I was taking all my prereqs and doing all of the education that I needed to take. And honestly, I still didn't know what I wanted to do. I was living with my mom before I went in the military, and then I moved back in with my dad, and I was taking these college courses, but I had missed basically being taken care of. Mm-hmm. And there was a Army recruiter that approached me 3 months after I'd gotten out when I was in Florida. And he's like, well, I want you to come into the Army National Guard. And the part of me, it was a big piece that was missing because I was so ingrained in the military and being taken care of. And I decided to drop school. It's like, this is not for me. I'm not academically inclined. Let's just drop school. And he's like, I'll promise you go to get you in as a medic. And I was off again. I actually had to go back to boot camp. So I went to boot camp twice. At that time, it was called Blue to Green, or a try one program. So they take anybody who's in a different branch of service, and it was supposed to be a gentleman's course that just molds you into a different to the Army. So you get to the Army regulations and the uniform codes, and they're not all the same. We have different rules and regulations in different branches of service. So I did that, and I went to Fort Sam and trained with the medics, and I was stationed with the 161st Medical Battalion out of Jacksonville, Florida. And from there, Hurricane Katrina hit in 2005. And even though I was on the Army National Guard, I was active pretty much the whole time. So with Hurricane Katrina, we stayed out at Pascagoula, Mississippi for 3 months. And it doesn't matter how much that I saw overseas, I saw so much more at home. Oh. And what wasn't being taken care of at home. And it really, at this time I'm 24, it really humbles you it's like, where really is the war? Is it overseas or is it home? And we're training with the medics, and I was a part of the groups that would go door to door to see if people were deceased or not. And by the time I was 26, I had seen the world twice and I had seen death more than I had wanted. And it was just, I decided not to go into medicine because I was like, I don't want to manage this anymore. I don't want to see this anymore. I don't want to see the trauma. I don't want to see the disparities that we have across, what is going on. And so it was actually my mom because I was like, well, I don't know what to do. I thought that I knew what to do. I thought I wanted to go into medicine. I thought I wanted to go into to be a nurse and be a surgeon and deal with trauma. And I learned really quickly that that wasn't for me. And so my mom was like, well, why don't you go to dentistry? And I was like, I don't want to look at people's mouths. That's gross.
Disgusting.
Yeah. And so, I came back home and decided I went back to school. I tried my hand and I was like, let's start dental assisting. And I went to school, a 9-month program for dental assisting. And I did a variety of different things. I worked with kids. I worked in the underserved communities. I worked in surgical offices. And my final landing pad as a dental assistant was in a periodontal office in downtown Seattle. And I loved the surgical side of it, taking care of people and doing grafts and assisting the doctor in all the big microsurgeries that you can see, just the intricacies of the different side of medicine and dentistry that people don't really talk about, that we don't see. And so from there, I started applying to hygiene school. And it took me years to get into hygiene school. I was taking my prereqs in hygiene school when I was in dental assisting school because I knew I had a child in 2007 and I was a single mom. And I knew that while dental assisting was great, it was the means to an end, right? I needed a little bit more. I needed to be able to financially take care of my kid. And so hygiene school was always in the back of my brain, but it really solidified it after I worked in the periodontal office. And so I was applying and I applied and I applied for years and I just didn't get in because I'm not academically inclined. I struggle with academics because that's not the way that I learn. I'm not if you tell me what to do, I'm not going to get it. I can visualize what you're doing, but until I'm actually getting in hands-on, it's really challenging for me to learn that way. So academia is always, even in high school, all throughout high school, I got really bad grades. I was in dental assisting school, I struggled, and even in hygiene school, I struggled. So anyway, I got in to hygiene school in 2013.
Congratulations.
Yeah,
Your
thank you.
perseverance paid off.
I was waitlisted. I applied to 3 different schools and I was waitlisted at one, and I was 9th on the wait list. And I didn't it was the day before classes started that I found out I got in. And I already quit my job. I had already quit my job. I was a single mom. I was living on my own with my kiddo. And I was like, what am I going to do? And it was 6 o'clock at night, sitting in the break room on the couch, just crying because school started the next day. And I'm like, what is going on? And I got an email. We're interested in having you in our program. Are you still wanting to come? And I'm like, absolutely. So I moved back in with my parents and I went to hygiene school and I lived in Washington State. My school was in Seattle, and I actually lived with my parents out on one of the islands, Camino Island. So it was an hour and a half commute every day that I took down to Seattle. And my parents helped me, with my daughter. And halfway through hygiene school, I met my husband, my now husband, and the rest is history on that part. But once I graduated hygiene school in 2015, I lived out in Oak Harbor. And growing up, my parents we just couldn't afford a lot. All of my sisters had braces, and I knew that I wanted straight teeth, and I was the only one that didn't. I've had 8 teeth removed, my wisdom teeth and my premolars, just to make room. I was super, super crowded. But my teeth were straightening out on their own, and the only girl that didn't have any braces. And I knew that that's what I wanted. I was like, I want straight teeth. Now that I'm in dentistry, how come I don't have straight teeth? How come I didn't get braces as a kid? And so I started down that journey in 2016. And I would see an orthodontist, and they're like, well, you have to have surgery. Well, why? That's how this whole thing started into myofunctional therapy. And so I went, saw another orthodontist. You have to have surgery. Saw another one. You have to have surgery. I'm like, okay, well, I guess I have to have surgery. And then I went and got my sleep test. I kind of heard about myofunctional therapy from a therapist who had come into my school when I was in hygiene school, but I kind of briefed over it. I'm like, well, this is really interesting. And then I just let it go. But learning that and peeking back into that, I learned about a little bit more about myofunctional therapy. And it's like, well, if I have teeth crowding, what else do I have?
Mm-hmm.
And so 2017, I put myself, I wanted to learn more about that. And not that with hygiene, I have to, I'm the type of person that I need variety. And even when I got into hygiene school, my girlfriend, one of my girlfriend, Katie, she was like, are you sure hygiene's the thing for you? Because it's very, this is what you do every
Routine.
day. Is
Routine.
that what you want? And I was like, it's only, and at that point in time, I didn't realize how true it was, but I was like, it's only a stepping stone to something bigger. And I bet I just didn't know what that was at that point in time, but I was like, it's stepping stone to something bigger. I don't know where I'm going to end up, but this is what I need to do to get to, wherever it is I'm supposed to be. And so I put myself through myofunctional therapy. I went and had a sleep test done. I didn't have sleep apnea. I went and did things I was supposed to do to make sure my teeth were straight, and I was healthy enough. And during myofunctional therapy, that was a big eye opener because it's like, okay, well, if I have these problems, who else with crowding has these problems? And I worked in a sleep office, a sleep dental office, and I learned a lot about myofunctional therapy there and sleep apnea, and learned that they're diagnosing sleep apnea in babies. Even though I didn't have it, there are other lying things that are going on as dysfunction. So went into braces 17. I needed in 2017. I needed orthognathic surgery. I had orthognathic surgery in 2019, where we had to move both my jaws forward and move my chin. And so after that period, being a myofunctional therapist, I mastered all of my exercises. I had surgery, and I couldn't do any of my exercises, and I couldn't move my mouth for over 6 months. I couldn't eat a hamburger. I couldn't eat a French fry. What is going on? I took a deeper dive into this. I looked into massage therapy, being a myofunctional therapist, helping people with TMJ, referring out to massage therapists, getting no correspondence back. What's going on? How can we collaborate better in an environment to help people with TMJ, to help people with trismus? And so I decided to go back to school for massage therapy because I found a need that wasn't being fulfilled. I've always been that person to take things apart and put them back together and see, and going back to being 6, 7 years old. And so I went to school for massage therapy, and in massage therapy school, I learned about lymphatic drainage, lymphedema therapy, all the post-surgical stuff that I kind of was tying back into my periodontal assisting time, and kind of tying back into my time in the Army. And so I went to school for lymphatic drainage, and then I learned about scar tissue. And I opened my business, Alameda, in downtown Seattle in 2001, strictly underneath my massage license. And I do some myofunctional therapy. My practice at that point in time was about 95% TMJ, people coming into me in pain. And so I would do the intraoral massage and do some of the lymphatic drainage and do the myofunctional therapy for more long-term sustainable results. In that time, people started finding me who had oral cancer and half their tongue removed or half their jaw removed and Bell's palsy, trigeminal neuralgia. So I started getting these really complex cases. And I'm like, there's something else missing here. And I started working with this very specialized population. And more that I did the health histories and learned about these people, the more I realized that there's really no post-surgical palliative care for these people going through these major surgeries, tying back into my own experience. And so I still, 95% of my practice is still TMJ, but I really started to focus in on the post-surgical, the pre-surgical, and the post-surgical aspect of it.
Sure.
And we were able to get tongues moving again. People who have had oral cancer 14 years ago, they've had 3 or 4 surgeries 14, 13, 12 years ago, and they can't move their tongue and they've been through speech therapy. And so now here we are, 2024, and I'm a big advocate for the postoperative pre-op, not only the postoperative side of it, because I see people who it's increasing their quality of life. We do everything with our face. And you can go see a physical before anybody has any type of surgery, they go see a physical therapist. It's called better in, better out. We want to make sure that we're functioning, we're moving optimally before surgery so we can move and function optimally outside of surgery. But why aren't we doing this with the face? The face is the first thing that people see. And with dentistry, it's more than the teeth. It's got to be more than the teeth. It's the tongue. It's the 58 muscles in the face. It's the muscles in the neck and how it connects to the cervical spine. And so because I'm like to take things apart and put things back together, I learned really quickly that not a lot of people work with pre-surgical prep, myofunctional therapy. How are you functioning? It's not just about airway and growth guidance. It's so much bigger than that. And then on the post-surgical side, how can I get you from where you were? I'll walk you all the way through and get you and functioning again. How can I get you to eat and talk and express yourself in your face? And not just with oral cancer, but people who have had major life-saving facial surgeries, facial reconstructive surgeries, Lefort 1, Lefort 2s, or Lefort 3s. And so I kind of just dove right into that. And now I speak internationally about the need for pre-surgical and post-surgical care, especially in the oral cancer population, because that's how oral cancer population, because that's how I tie in my dental background and in my medical massage background into collaborative programs to and continue to advance dentistry. Long story.
Oh my gosh, it's an amazing story. And I don't know if you saw, but I was taking notes because I have a bunch of things that I want to go back to and connect with. So first of all, thank you for your service. I don't think we say that enough. And, especially being women and going into battle, I'm sure it's frightening. And I'm sure there are some things that you remember that nobody should ever have to see or remember. So thank you for your service. So that's the first thing. The cross training, I think, is one of the best things that anyone could ever do. I, as a young mom, and my daughter was growing up in her junior high and high school years, one of the first things I told her was, I was a dental assistant. I was a dental hygienist. I was the woman running the front desk. I became the dentist. There isn't a job in the dental office that I don't know how to do, and I'm willing to do because, we all put our pants on the same way, right? I mean, I don't care about taking out the trash. It's okay. I can take out the trash. But I told her very early on, the more you can cross-train in whatever business that you're in, the more valuable you become. So you became valuable because you were able to fit into places and do things that the men couldn't do. So thank you for doing that. Good for
Thank
you.
you. Yeah.
Good for you.
I was one of, at that time in 2000, I was one of 40, I was one of 40 women in a shop full of, in a machine shop full of men.
Mhm.
And then I was one of 300 or 400 women on an entire ship full of 6,000 people
Wow.
of men. I mean, and my dad was a Navy diver. I grew up around the military community and, working, it's one of those things you kind of just have to see where you fit in
Yeah.
and become one of the guys. And so, and I had my girlfriends too. But I really fit in with the guys and just adapting to the environment. You have to be able to adapt to the environment,
Great,
especially as a woman in the military.
great
Yeah.
advice. Really good advice. Second point I want to bring up is I also lost a patient in 9/11, so had a tremendous impact on me. I have no doubt being there. I'm sure you got off the ship and you were part of the team helping to clean up New York City. Is that correct?
So no, we were outside of the New York Harbor. We stayed on the ship. The Army Guard and the Marine Corps were the biggest ones out on land. Our airplanes were the first airplanes, the aircraft that were the first to fly over New York.
Okay.
So we stayed on board. We weren't at that time because we were still doing our workups. We weren't equipped to go. Our medical units went on land, but I was part of my job. I was I worked in the air
Mhm.
with the aircraft. So my job was just to support the aircraft so they can fly over.
Right.
Yeah.
Well, it doesn't matter. You still were there, and I'm sure it had an emotional impact on you as well.
Yeah.
So something that we share. Next thing I wanted to talk about is I love the fact that you're heading in the direction of pre-surgical and post-surgical prep. I have never heard of anybody doing that. And we have a oral maxillofacial surgeon that does Laporte surgeries, and I know there's a lot out there that do it, but Dr. Sue J. Morgan is internationally renowned for what she does with reconstruction. So I'd love to connect the two of you because I don't know if she has post-surgical and pre-surgical prep. And do you do it virtually? How do you see your patients?
So I can do it virtually. I've actually started to see quite a few patients virtually. Currently, right now, patients fly in to see me and I do the myofunctional therapy before, and I try to find the patients and massage therapists where they're at. We
Mhm.
can only do so much pre-surgical prep on ourselves. It really takes a skilled hand to go into the muscles and see exactly what's going on.
Mhm.
I have seen people virtually for lymphatic drainage, so post-surgical care. I've also seen people virtually who have had the surgery and their partners there. So I'm teaching their partner how to do these things on their significant other or their family member after surgery. So the access to care is there. It's just finding it and realizing and grabbing on to the social, not social media, but grabbing onto the virtual aspect of it.
Mhm.
So is it effective? Yes, it has been so far. But most of the time I see people in the office or I've gone into their home. So as soon as they have surgery, is you're exhausted. 100% I get it. So I go into their home, I do the lymphatic drainage, and then once they're out of that 6 to 8 week time frame of healing, then we're going in and trying to get them to open back up again. And so they can eat normally and go back to what they feel as was normal, almost as normal as before.
Yeah. So tell me and the audience how long it takes to get somebody back into function after major surgery like that.
So it depends on if I saw them before. I'm always educating to establish a baseline. My goal, if they can only open 28 or 35 millimeters, my
Mhm.
goal is to get them to 40 millimeters or above. I because if they're so tight and so locked in and they're getting ready to go in for surgery, the chances of them healing more efficiently is going to take longer because their muscles, their body's not ready for surgery. And so if I see them before, I tend to see them 6 to 8 weeks before surgery, sometimes longer, sometimes shorter. Sometimes they'll say, I have surgery next week. What can we do? Well, we'll see you on the other side of surgery. And just take it from there. On the other side of surgery, I make sure that, of course, we have medical clearances because I have seen people with non-union. And non-union, for the audience, people don't know what non-union is. It's when you have surgery and the bones don't fuse.
Mhm.
And so medical clearances, but I typically see them immediately post-surgical, 2 to 3 days post-surgical. We're doing the lymphatic drainage. I'm teaching their significant other how to do the lymphatic drainage and to get the swelling down to reduce the amount of scar tissue buildup and reduce post-surgical neuropathy. And then it takes at least 6 weeks for me to start getting really hands-on into the mouth again to opening back up to where we want them to be. And then I'm tying them immediately back into myofunctional therapy and facial exercise. Pre-surgically, I'm not just working with the muscles of the tongue, I'm working with the muscles of the face. I want to make sure that you can smile evenly.
Mhm.
Because if you can only smile strong on one side, then we're really working on this side, especially if you're going to have a Lefort 1, because all the muscles that are attached to those bones in this area, I want to make sure that they're healthy enough and strong enough before surgery and make sure that these aren't too strong. These are a lot
Mhm.
more relaxed before surgery because they'll just pull those bones right back. So it could take anywhere between 6 months, I think, is the longest. 6 months to a year is the longest that I've seen people in a pre-surgical and post-surgical state. If they've seen me post-surgically after oral cancer, after part of their jaw is removed or their tongue is removed, it depends on how long it's been since their surgery. Within 7 or 8 sessions, we can get more mobility back as long as we're staying consistent. And then my job is to release the scar tissue and help mitigate the neuropathy, and then sending you home with your exercises to keep you moving, to keep the lymphatic system, to keep the lymph down, and to increase range of motion that way. So it's really subjective.
I just, all of this talking just reminded me of a patient that I saw recently that had a tooth removed, developed a cellulitis, and almost died from it. And so now she has a very limited opening. And she came in and had cracked the tooth behind it. Now, in her mind, was cracked during the surgery she had on the tooth that caused the cellulitis. The dentist, I don't know the story behind it, and it's not important. But anyway, it was a very rough extraction, and she did not fare well. But now she's got a cracked tooth, and I was going to take it out for her. She was in a significant amount of pain, and I wasn't sure I was going to be able to get in there, but she would be a classic person to have you see because she can only open so much. And fortunately, I cut the tooth in half and took it out one root at a time, and the fractured piece came right out. So, I was very fortunate that, I approached it that way because it was easier to handle, easier for her. And it was out in, maybe 5 minutes. So it didn't take long, but at least I know that I didn't cause her any more trauma. But I was very concerned about that. Like, what is she going to do for the rest of her life, not being able to open her mouth? So I think it's, for anybody listening, if you have patients that are tight like that, definitely Rebecca's the person to refer them to, because I have not met another hygienist that's doing pre and post surgical treatment. And you have both licenses, massage therapy and the dental hygiene. So you understand the whole thing. I think it's phenomenal.
Yeah.
It's kudos
Yeah.
to you. Good for you.
Yeah, and I really advocate for hygienists and dentists to be doing these things chairside.
Yeah.
The biggest concern that I get from hygienists is that, can we do this? Is it in our scope of practice? And it's really unfortunate that what I find in hygiene is that, in my experience, that I don't understand why hygienists fear more of what we can't do than more of what we can. And it's not invasive. It's absolutely something. And we're already doing it. There are hygienists that are like, oh yeah, I already do intraoral therapy for people who can't open their mouth to get them through their dental cleanings. So that's when I developed the Institute for Orofacial Recovery or Orofacial Recovery Institute. Now I changed the word because that's a lot. But so I'm building my tribe now.
Yeah.
I'm
Perfect.
trying to find the hygienists and the dentists who are interested in taking myofunctional therapy and advancing really beyond airway and growth guidance and rehabilitative care to help a greater population chairside. And because I mean, I've talked to other massage therapists, and they have, they know what they know, and then the dental hygienists and dentists know what they know, and it's like, how can we get these two together? And how do we hire on massage therapists? How do we get myofunctional therapists to do these things virtually? And getting hands-on and teaching and training, and so we just launched our first course is in October. That's going to be here in
Congratulations. That's
Seattle.
fabulous. Is it already
Yes.
full?
It's not filled. There is a 50% discount that I'm offering to that. I've got a TMJ chiropractor who's coming in. It's going to teach there's 2 days. It's 8 hours online, but then 16 hours hands-on, because we really have to get in to the muscles to feel what's going on so we can
Mhm.
guide our patients better, even virtually. So the first day, I've got a TMJ doctor coming in, a chiropractor who specializes in the suboccipital technique. And so he takes a deeper dive in the TMJ and the craniosacral and how the cranium works and the bones in the cranium. If they're not fitting, the night girds aren't going to work, and the cervical spine is going to be off, and the hips are going to be off, and everything else is going to be thrown off. So he's coming in the first day, and he really integrates dentistry. He's been doing it for years. He integrates dentistry and medicine into that. He's kind of done what I do. And then the last 4 hours is intraoral massage, opening back up the jaw, getting things moving again. And then the second day is lymphatic drainage. First 4 hours is lymphatic drainage and just head and neck, just teaching how to do that so we know how to do it virtually. In the last 4 hours of the second day, I've got an oral cancer survivor, Michael Cranston, coming in, who's going to talk about his experience with oral cancer. And he's going to be a body so people can feel the scar tissue and how to release the scar tissue. And so it's going to be really integrated. And it's just going to be awesome. I'm so excited. I've got one in October and the other one is in January. I haven't planned anything else after that yet. I'm going to kind of see how these first two courses go and modify from there. And I think that's all that's what everybody does when they first launch a course, to kind of fine tune things. But yes, there's a 50% discount because it's like, come in and see what we do and earn some CE in the meantime.
Excellent, excellent. Well, I'll be sure that that information, if you'll send it to me after
Yeah.
we finish today, that I'll make sure it's on my YouTube channel when we launch this podcast, because I would love to support you. I think this is just phenomenal, and you're so spot on. You didn't know what you were going to do, but you knew you were going to do something bigger than that, and you
Yes.
are doing it. And kudos
Yeah.
to you. That's
Yeah.
amazing. I'm just so thrilled for you, because you must be getting so much positive reinforcement for doing what you're doing. Like, it just being able to give back and do something for somebody, especially at such a traumatic point in their life, just being
Yeah.
able to give back and help them is just amazing. You're giving me goosebumps. It's just good for you.
Yeah, and it's, honestly, and it's been a bumpy road. You were talking about we were talking about before about imposter syndrome. Oh,
Mhm.
100%. It's like, is this really going to work? You're breaking into new territory that nobody's ever done before. You're combining all of these things that nobody's combined. How is this going to work? I mean, I'm always questioning myself, am I doing this right? Do who am I gonna? I mean, you definitely have to have a team come in and help. But the imposter syndrome is the first couple of years starting the business, it was big because there were more money's going out than coming in.
Yep.
And now here we are 3 years later, and I've had a second interview with Fred Hutt and Seattle Cancer Care Alliance because they're interested in what it is that I'm doing. And so it's like, okay, so now we're finally building traction. But 2 or 3 years ago, I mean, I would come home and I would cry. It's like, what is this really going to work?
Yeah.
Is what is going on? Because it's really, I would talk to doctors and surgeons and I would drop off all of my information. And people are like, what are you doing? I've never heard of this before. How do you so that's been the biggest challenge out of all of this is breaking into something brand new that nobody's really looking at, nobody's doing. And it's not going to stop there. I mean, we're still going to do so much more. This is just the beginning. But yeah, imposter syndrome was big, huge.
The one thing I've learned about imposter syndrome is you just need to acknowledge it and move on.
Yeah.
You know,
Yeah, you got to step right in.
yeah,
Yeah.
just keep on going because,
Yeah.
like I shared with you in the story before we started the recording, I didn't know how to run a podcast. I knew nothing about a podcast. I'm not
Mhm.
a person that likes to be on video. I'm not a person that likes to be in front of an audience, but I did it because it was important to me to find a mechanism to share how women gain confidence so that I
Mhm.
could help my students. And that's basically the bottom line is I just wanted to help these kids who are growing up with no confidence. Why
Yeah.
is it in this day and age where we're still bringing up children with no confidence,
Yeah. Yeah.
I don't get it. I mean, I have a very strong daughter myself. I'm very fortunate, but maybe it was her environment seeing me go through dental school at a young age that impacted her. I don't know, but whatever it is, we have to figure out how to do this better.
Yes. Yeah. Because people don't know what you don't know.
Right. So it's so true. They think they know everything, but they don't know what they don't know. You're right.
So yeah, I learned that a long time ago. Your patients don't know what you don't know, and they think that you know everything. So
Right.
just jump right into
Just
it
keep
because
going.
yeah.
Well, I love your story. I know the audience is going to love your story, and I'm sure you're going to have lots of reach outs from your content because this is important. I think that we can all,
Important.
I mean, if everybody just creates a little nidus of help in their little area, gosh, we could reach so many patients, and people get
Yes.
oral cancer all the time. So why not? So I'm just so proud of you. I just so glad that you just moved past that imposter syndrome. You felt the fear, you did it anyway, and you're just making an impact on this profession and on society. So congratulations.
Thank you. Thank you.
You're welcome. All right. So tell us one thing that people would be surprised to know about you.
One thing that people would be surprised with, I mean, I'm going back to school. But I'm going back, but I'm actually, believe it or not, I'm going back to school for nursing. I am finishing my degree. I'm getting my bachelor's in hygiene, and I'm going into nurse practitioner because I want to specialize in head and neck oncology and the hospitals and taking myofunctional therapy there.
Oh my gosh, that's amazing. Good for you.
Yeah.
Good for
So
you.
my biggest push right now is getting the hygienists into the hospitals. Hygienists are in hospitals across the world, except in the United. They're few
Yep.
and far between in palliative care and acute care in the hospitals. And so I mean, I've been preaching to the choir. I've been trying to get hygienists in hospitals for years, but I feel that I really need a little bit more of a stronghold. I got to go into it in order to
bring
grab
everybody
again.
with you.
Yeah. Yeah.
Good for you. Oh my
So
gosh, great move.
that's the next step.
Great move. Oh
Yeah.
my gosh. All right. So to me, today, you're so confident, and I see nothing but great things ahead for you. Have you always been that way, or is it something you've developed over time?
It is something that I have developed over time. So I mean, I have three sisters. Growing up, living with my mom, living with my dad, I guess I've always been confident in certain ways, but and developing new things. But I've really fine-tuned it over the years and being a very strong force in what it is that I do. When I get onto something, I don't stop. I grab onto it and I hold on to it and I say, this is what we have to do. This is what needs to be done. This is how we do it. As much as I've been a follower in my life, I'm very much a leader. I'm very pliable in that. When it comes to learning something new, I always take a step back and I absorb. But once I absorb, then I take it and I run with it. And even in all of my jobs as a bartender, as a waitress in the Navy, I've gotten awards and accolades because I've always taken something not to change it, but to make it better.
Yeah.
How can I make this better? And so my past, because of my experiences in my past and where I'm at today, they've really molded me into who I am and then who I'm gonna be in the future. So it's I guess the confidence has always been there. It's just gotten stronger over time.
And you're not intimidated now about going back to school, which I love because, you felt like you were not a good learner, but you have figured out how to learn, whatever the case may be, because now you're going into nurse practitioner.
Yes. So I am nervous. My confidence talking. It's good.
That
I am
imposter is talking, not you.
right. I mean, it's mindset.
Yeah,
I've learned
mindset.
mindset. If I keep telling myself, and I learned this in hygiene school, and it worked. If I keep telling myself, this is hard, I'm gonna fail, then the mind is gonna say, yes, it's hard, and you're gonna fail. So I stopped saying this is hard and I started saying this is challenging because I like a challenge.
Yeah.
I like a good challenge. This is, and even when I tell my patients, because they're like, oh, it's so hard. No, we don't say hard. It's challenging. This is an obstacle that we have to overcome. So going back to school, am I nervous? Yes. And then I have to continue to remind myself of my competence that yes, we can do this. You're going to be okay. It's going to be challenging, but as long as you set your mind to something and grab onto it, you're going to be just fine.
Great advice. What is the single best piece of advice you've ever gotten? And from whom did you get it?
Elijah Desmond, I'm a shout out to Elijah. He talks a lot about growth mindset. You have to be in a growth mindset.
Mm-hmm.
So I've had to learn that, but it's my best quote. Honestly, I love cartoons. It's keep swimming, just keep going.
Yeah.
The moment that you stop is the moment that things are to come crashing down. Mm-hmm. And going back into my life and looking at all of the things that I've been through and even in the army when we had to ruck a 50-pound sack up a 75% incline. The moment that you are doing that, if you stop, you're never going to get going again. So you just have to, as in the words of Dory, keep on swimming.
Keep on swimming. I love it. I love it. Who do you think has made the biggest impact on your life?
I like to give accolades to the men in my life. My dad, number one. He's always been a stronghold, but I would say at this point in my life would be my husband. He He is not afraid to tell me no. And he is where I'm the emotion, he's the logic. He has made the biggest impact on my life in the sense that he grounds me because I can be flighty. I'm always thinking of all of these things and the things that we can do and we got to go here, we got to go here, we got to do this. And he grabs these things for me and he's like, okay, let's take it one step at a time. This isn't going to work. You need to write it down. You need to find a plan. And he's one of the biggest reasons why I am successful today is because he keeps he keeps me sane. And he drives me insane, but he keeps me sane.
They all do. That's okay.
Yeah. But if it weren't for him, I mean, I don't know where I would be right now. He's allowed me to, he's taken all of my ideas, but he's made me really focus
That's
on
all.
what it is where I'm supposed to be and where I'm supposed to be going. So yeah, we've been together for 10 years. And without him, I mean, I don't think I would be anywhere near where I'm at today without him.
Sounds like a great love story.
Yeah, he's great.
That's awesome. That's awesome. We can, live without them, but it's not
Yeah,
a great life, right?
right.
So
Yeah,
as much as
yeah.
we each drive each other crazy, it's always nice to have somebody in your life who's your biggest cheerleader.
Yes, 100%. And, he tells me no, which is good because we would be very broke. I always have all these business ideas, and he's like, can you afford it? Well, no. Okay, well, then let's refocus. What do we need to do to get you there? So, yeah, he's definitely he's my biggest support throughout all of this, even with going back to school.
That's
So, yeah.
amazing. Great story. Great love story. So, have you had an aha moment where you've realized, oh my gosh, I'm doing exactly what I was sent to here to do?
Lots,
Yeah,
lots.
I bet.
And there's still more to be done. So, yes, because I always tie in what I'm doing now to the experiences that has got me here.
Mm-hmm.
The things that I've done in the past, the dentistry, the being in the army, being, since I was 6 or 7 years old, taking things apart, putting things back together, having the experience that I had being in the military, seeing what I saw, being working in a surgery office, all of the little pieces I see in my day to day that tell me I was meant to do this. I have been training for this my entire life.
Life. Yeah.
Yeah.
I
Yeah.
had that thought myself earlier.
Yeah.
Every single increment in your life has led to today.
Oh, yeah. And that's how you know that you're on the right path.
Mm-hmm.
It's because, well, even working with people with oral cancer, without oral cancer, with TMJ, and we talk about dentistry and things like that. I'm like, well, if it wasn't for that experience, I wouldn't be able to answer this question. Or if it wasn't for the experience that I had in the Army or the Navy or, growing up all the way through school and the perseverance, I wouldn't be where I'm at.
Mm-hmm.
But my entire life comes into play every now and again when I'm working with people.
I bet. All right.
Yeah.
What about an obstacle that you've overcome that you're really proud of?
Time management. It's
It's a big one. People
huge.
can waste a whole entire day doing nothing because it's the squirrel, right? The squirrel thing. Oh, let me go over
Yeah.
here. Oh, let me go over here. Let me go. And they don't
Yes.
stay focused. Mm-hmm.
Yes. And so, and that's, going back to my husband, I thank him for that because he really focuses me, but it would be time management. I mean, it's so easy to get carried away because I'm always with every new patient, I find something else that I want to be able to do. Like going into nurse practitioner, I want to be able to do photobiomodulation and help with oral mucositis and being on the palliative care team. And um, again, that's going to tie in my dental background in that. But I wouldn't be where I'm at today if I hadn't learned how to manage my time and my energy effectively, because I would be off in La La Land doing something else, or I would be in. We had talked about going to dental school. We had talked about going to school for physical therapy. We had talked about going to school to be an osteopath. We had talked about all of these things. And if I really hadn't sat down at my computer, I was like, okay, let's make a plan then with the time and schedule, then that's been the most challenging for me.
That's
So
good.
I'm always go, 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 go. Yeah.
You'll get a lot more accomplished having
Oh,
those
100%.
skills.
Oh,
Yes.
absolutely. Yeah.
How about a guilty pleasure or a secret dream?
I want to travel more.
Mm.
Guilty pleasure is chocolate all the time. Chocolate M&Ms. Chocolate M&Ms and red wine. Okay, that's my go-to, and popcorn. But
There you
um,
go.
you have to
And
have
maybe
all
all three of them all at once, because that's a really good combination,
yeah,
the salty and
you're
the sweet. And
yeah. But biggest dream would be to just to travel. I want to be able to work more via telehealth going into my retirement. And I want to travel the world. I mean, I traveled all of Europe when I was in the Navy, but I've never traveled over to Asia.
Mhm.
My husband was 20 years in the Navy, and he traveled all of Asia, but he's was never really over in Europe. So I
Good
want to
combination.
I want to see the seven wonders. I want to see the wonders of the world. I want to go back into history. I want to hike. I want to backpack through Europe for a couple of months and just enjoy, because I've been working. I mean, I had a newspaper route at 14. I've been working my entire life. And so my biggest dream would be to travel and see the world and be able to touch more people
Hmm.
on a bigger scale. Yeah.
Absolutely. Do you have a
Yeah.
personal motto or a mantra that you live by?
Yeah. It's actually one of my favorite quotes by Mother Teresa. I alone cannot change the world, but I can cast a stone and create many ripples.
Yeah. And you are,
Yeah.
definitely. I can just tell it, feel it in my whole body. Um, it's amazing what you have in front of you. I see some really great things happening for you. So
Thank you. Thank you.
I can't wait. We're gonna have to do another interview in a year
Yeah.
so you can
Yeah.
update us on where you are and what's going on, because this is a
Yeah.
really good story. All right.
Thank
So what piece of advice would you give young men or women coming into the profession of dentistry today?
Don't be afraid of change.
Mm.
Don't be afraid to change. The only way that we can grow and move forward is to change what it is that we see. If you feel that it can be better, we get so, speaking from experience, we get so stuck in our ways. And I hear it from time to time. Why change what works? Because we're always evolving and growing.
Yeah.
So push the paper, push the button, see how far you can go. See how
Great
far
advice.
you can change the world. Yeah.
Great advice. There is so much more to dentistry than sitting down and cleaning teeth. There's so much more
Oh,
to dentistry than doing fillings and restorations. And yes, would I absolutely love to see less restorations and more prevention? Absolutely. But that's
yeah.
not how our system works today. And it's going to take an awful lot for that to change. I have been a big proponent of creating the dentist and the dental office as being their family medicine home, because we see patients much more than a family medicine doctor does. And
Yeah.
you can't get in, and you
No.
can't have the test done, and you can't do this and you can't do that. Well, let us help you in the profession medicine, because we actually do see your patients on a regular basis. We actually can give vaccines. We can do so much more. And I think COVID has started to move that boulder up the hill. And I think it's going to take some time for us to get there, but I definitely think it's going to get
Yes.
there. It's not going to be
Yeah.
my mission to complete, but somebody's going to pick up that boulder and keep it going.
Absolutely. Yeah. Combining medicine and dentistry. I mean, it's one whole unit.
Yeah. I
So,
mean, the mouth is not separate.
oh,
It cracks me up all the time. Yeah. The mouth and the head is not separate from the rest of the body. It's all
no,
attached, people.
it's one long tube. Right.
Yeah. And
What goes in must
18
come out. Yeah.
and 18 different systems in our body are affected by the
Yeah.
bacteria in our mouth. So don't
It
tell
is.
me that we can't help in this journey to support
Yeah.
patients into better health. We can.
100%. Yeah. Yeah.
All right. Looking back from where you are today, what is one piece of advice you would give your 10, 11, 12-year-old self?
Be patient.
Ah, now why?
I,
Explain a
I
little
am
bit.
not patient. I want what I want. I want it now. um, be patient with yourself. Allow yourself to learn. Allow yourself to grow. Learn how to take a step back and look from the outside
Mhm.
before jumping into the inside. Even to this day, I'm learning patience. When I built my practice, and I think that has a lot to do with the confidence and the imposter syndrome, is because I want it. I opened my practice. It's like, okay, where's everybody?
Every
How can
one of
people?
us does that, even with our own dental
Yeah,
practices. So you're
yeah,
in great company. So
yeah, yeah. So, be patient. Things aren't always the way that they seem. And when we take a step back and actually look at the bigger picture without tacking first, because I've had to learn that. Um, I've always taken things like this is the way that it is. And then I learn over time, okay, I was wrong.
Mhm.
Because when I had first learned about doing the massage therapy and hygienists were coming to me and they're like, well, I want to do that too. And I'm like, well, no, I spend a lot of time and money in massage therapy. You can't do this. But then I learned with patience and gratitude that, and I'll be the first to admit that I was wrong because I've been wrong on many occasions, and that's okay.
it is okay.
Um, um, that with just a little time and patience and skill and knowledge, and now I'm teaching dentists and hygienists. It's like, you know, this is a missing piece in dentistry that we should be doing. So, take your time, learn, grow, and just, see where you're going to be. Be patient.
Hmm. You don't
Yeah.
have to know where the road is going. You really don't. You just have to
No.
keep driving and watch that middle lane, right? As long as the middle lane is in sight, you can continue to go.
Yes.
As long as you take one more step, just one step
Yeah.
every day, you'll
Yeah.
get that much closer and accomplish a goal, whatever that case may be.
Yeah.
How do you define success?
Spending time with my family,
Ah,
being able to financially spend time with my family, um, all while simultaneously helping others. It's so easy to get caught up in work and work 25 hours a day, 8 days a week. It's so easy to do that. So success for me has been able to balance spending time with my family, spending quality time with my family, all while still being able to take care of people that need to be taken care of. That's not my family. And to be able to financially be, be able to contribute to all aspects in what it is that I do.
amazing, amazing. And I know the answer to this question, but I'm going to ask it anyway. Do you feel successful?
Yes, I feel successful. And I also know there's more work that needs to be done.
So yes, and I have more work to be doing.
Yes.
Excellent.
Yes. And there's more work to do. Yes.
Yeah, very good. Rebecka, I can't tell you how thrilled I am to have had this moment in time with you. If anybody wants to find you on Instagram, tell us how to find you.
So I'm at the
Facebook.
rehabilitative hygienist. Yeah. I'm at the on Instagram at the rehabilitative hygienist. And on Facebook, you can find me either at the Oral Facial Recovery Institute or Alamedin or even Becca Clark. And I'm on LinkedIn as well under the Rehabilitative Hygienist. And I do have a YouTube channel. I think it's still under the Rehabilitative Hygienist. I have to look. I'm so busy that I just dove into so many different things. And so you can almost find me anywhere. Might not be active 100%, but
That's amazing. So we'll make
definitely
sure that
there.
everything is listed under your podcast on our YouTube channel, and make sure that we connect the dots back to you.
Yes, yeah, awesome. Thank you.
You're welcome. Thank you so much again for your time. It has been my pleasure to
Yeah,
have you on the
thanks for
show.
having me. So thank you so much. And to Vanessa who connected us. So
Absolutely. Absolutely. Thank you so much for listening to the Women in Dentistry podcast with Dr. MJ Hanlon. If you like our show and want to know more about us, check out our website, thewomenindentistry.com, or please leave us a review on iTunes. Join us for our next episode as we bring you another amazing woman leading the way for the next generation.